It is really, really good to see so many folks here tonight. When the first thing I found out upon waking up this morning, the ETSU was closed for the day, I had this sinking feeling that we brought in some of the world's real experts in health to learn about rural health, and they weren't going to have a chance to meet you, and you weren't going to have a chance to meet them, but it was really reassuring to see so many of you here. This is the third in this year's Leading Voices in Public Health lecture series, and I think you're going to find this to be a really special session. In keeping with the theme of Leading Voices, it's my pleasure to introduce the person who will introduce the person who's going to introduce the speaker. That makes me the person, anyway. It's my real pleasure to introduce the person who has been really the heart and soul and the spirit behind a new school of public health at ETSU, someone who needs no introduction to you all. Please join me in welcoming the president of East Tennessee State University, Dr. Paul Stanton.
Thank you, Dr. Wyckoff, and good evening. I agree with Dr. Wyckoff. The fact that this room is packed on a day in which I unfortunately had to declare the campus closed during the daylight hours anyway, but thank you for coming. I have the great opportunity to introduce a very special friend of mine, and before I do that, let me just thank Dr. Williams and the Robert Wood Johnson Foundation and the commission that's here looking at what we're doing in this area of our state and country. We've just finished a 2-hour session that I found very informative as I sat and listened to many people give some feedback on activities here. But I want to introduce now a great American in Dr. William Bill Frist. Bill and I have known each other for a long, long time. We first met in surgical circles when he was doing transplants over at Vanderbilt, and I was first in Atlanta, then up here doing some vascular surgery. Dr. Frist and I talked about his plans to run for the U.S. Senate. I have to say at that time I thought that was a formidable undertaking, but he did it, and he did it very successfully. He represented as a U.S. Senator our state of Tennessee and Washington for 2 senatorial terms, and had the privilege and the high honor of being the Senate Majority Leader. Now, there are very few people in this country that will ever achieve that lofty goal and that lofty rank. But let me now ask you to join me in welcoming a very great American and a human being and physician who cares about your health and mine, Senator Bill Frist.
Thank you. Thank you. Thank you, Dr. Stanton. It's an honor for me to be back at the university. Many of you have seen me multiple times, and it's, I have to say, it's kind of nice being back and not being in the United States Senate. Dr. Stanton and I have had a long relationship in surgery as colleagues, working together for this university, and working together, which this university does every day, for the peoples of this region. And that region is very large, as all of you know. And that's what we continue today. And we'll probably be able to do things like this many times in the future. But the sole purpose for us being here and our commission to be here is to listen and to learn, and then to share that with people over the United States of America. A lot of my work as Majority Leader took me to Sudan, to South Africa. I was doing surgery in Mozambique now 6 months ago. But I'll have to say what I enjoy most is about being right here at home and being with the people of Tennessee, addressing the very same issues of access, of cost, of how you truly build a healthier community, a healthier America. It's the people of Tennessee that I was thinking about when I first met the man I'm to introduce tonight, David Williams. David Williams, a Harvard professor, renowned expert on the social influences on health, on the gaps in our healthcare system today, on health disparities. Currently director of this Robert Wood Johnson Foundation commission to build a healthy America. The commission represented today before over the last 2 hours, listening very carefully. Dave and I sat down together in 2007 to discuss the possibility of me becoming a commission member for this very important commission, a commission that would explore the sort of bold ideas, new ideas, ideas outside of hospitals and doctors, but these determinants of health. And this commission, indeed, over the last year has investigated how and why it is that America spends so much more on healthcare, twice as much as any other country in the world, yet the outcomes, the objective outcomes of how long we live, or infant mortality, are so much worse. A lot of people think it is because of doctors and hospitals and critical care units, and it isn't. And that's what we're to study. David Williams said that rather than looking only for solutions inside this healthcare system, which clearly is overburdened in so many ways, we had to focus more intensely and with a lot more care on those other factors, the socioeconomic factors, the factors of education, the factors of environment, the genetic factors, the sort of influences that a lot of people don't initially think about when they think about quality of life or how long one is to live. The commission would examine the choices that we make in our everyday lives that have a huge determining impact on our quality of life and on our health. It would examine barriers that too many Americans face in trying to make healthy choices. And ultimately, as a commission, listening very carefully like today, we'll propose solutions that will be distributed back to you, back to states, back to policymakers, indeed to people throughout this country. I was intrigued by the idea, but I had one condition. That's it. I bought in, I was sold, but I wasn't going to do it unless we had today and tomorrow, where we could expose the commissioners, and through those commissioners, through that report, to the American people, to the influential people who'll be setting policy for the future, to you, to your ideas, to rural America, to the realities of health, not just health care in Appalachia. And David Williams said, yes, it is an important part of what we do, too often overlooked as we focus on cities and suburbia and where the money flows and places like Nashville instead of the other regions, and that's why we're here today. The commission, which is led by David, is made up of 14 commissioners that represent a whole variety of occupations and professions, from the unions to physicians to business to education to government. And over these last 11 months, we're identifying those factors, and we will distribute those accordingly. Tomorrow, we have had a great day today, the last 2 hours. Tomorrow, we're going to be going over to Sneedville. We're going to be going to Big Stone Gap. Later in the afternoon, just looking at our schedule, we'll be going over to Duffield, Virginia, to the CareSpark offices. We'll be looking at the reality of health, not just health care, but of health in Appalachia, in those rural communities. I am pleased, now putting on the hat of a Tennessean, to welcome David Williams to Tennessee, to introduce him to the staff, to ETSU, to the peoples that we'll see tomorrow. David is the best of the best. He's the Florence and Laura Norman Professor of Public Health at Harvard School of Public Health. He's a professor of African and American Studies and of Sociology at Harvard University. His research has focused on the trends and the determinants of socioeconomic and racial gaps, racial disparities on health, the effects on health, and the ways in which the religious involvement can affect that health. Robust in terms of publication, over 150 peer-reviewed articles, papers, and scientific journals. He's been ranked in the top 10 of the most frequently quoted social scientists in the overall literature, if you look at 1995 to 2005. He's provided editorial insight of 8 scientific journals and been a reviewer of more than 50 others. He's been involved in this overall development of health policy at the national level in the United States. He served on the Department of Health and Human Services National Committee on Vital and Health Statistics and on 6 panels for the Institute of Medicine. As I mentioned, David currently guides the activities of the Robert Wood Johnson Foundation Commission to build a healthy America. On behalf of all Tennesseans, on behalf of everybody from this region, I want to welcome David here with us this evening to lead a discussion on the work of the Commission. Please join me in giving a warm welcome to my colleague, a man I tremendously respect, a leader in a field which will directly impact millions of lives, David Williams. Hey, Dave. All right, man.
I want to thank Senator Friss for his very, very kind words of introduction, and I certainly want to thank Randy for all the work that he did into making this such a beneficial and successful visit for the staff of the Commission who's visiting here, and all of those who participated in the last session we've had. We've learned so much from being here already, and we're really looking forward to tomorrow. What I plan to do tonight is give you a quick overview of the work of the Commission, and then we hope to have time for questions and discussion. And joining me then will be Senator Friss, one of our commissioners, but also some of the Commission staff who's here with us. Dr. Wilhelmine Miller is the Associate Staff Director of the Commission, and she will join us, as well as Dean Rosen, one of the communications experts that we are working with. So again, it's really great to be here with you, and I'll jump right into my presentation, which will give you a sense of the work of the Commission. So as you well know, the Commission is called the Commission to Build a Healthy America. And the Robert Wood Johnson Foundation set up the Commission because it perceived that there was a health crisis in the United States. And as Senator Friss mentioned, we're not talking about a health care crisis, but a health crisis. In the United States now, recent research reveals that some Americans live as much as 20 years longer than other Americans, linked to where they live and their racial or ethnic status. The US leads the world in medical care expenditure, some $2 trillion each year. I discovered a stunning statistic from the World Bank. The US spends annually 50% of all the money spent on medical care in the world. You heard me right. We consume 1/2 of the world's medical resources. Yet, in life expectancy and infant mortality, 2 of the very widely used indicators in international comparisons, we rank at the bottom of the other industrialized countries. Poor health is hurting us. It limits our ability to fully realize the potential opportunities of American society. Poor health hurts us in terms of our economic competitiveness and our productivity as a nation. When you look over time, the research reveals that some of the health gaps within the population are actually increasing over time. Some are stable, some are absolutely increasing. And these gaps by geography, by race, ethnicity, by income and education are large, and they are unacceptable in our society. So the charge of the Commission was really to think about 2 big questions. Why isn't America one of the healthiest nations in the world, given our investment in medical research, in medical care, given our standard of living? Why aren't we healthier? And why are some Americans healthier than others? You say, why now? Why did we think that this was a good time to think of a commission? Well, there's a lack of an awareness about the problems and lack of policy action. There is attention to the problem of medical care and the medical care problem, but less attention to the health problem. Among many policymakers, we did some research with many of the leaders in both political parties, and there's little distinction between health and health care. There's a lot of focus on coverage and quality, but not much attention to health. There's a strong feeling that individuals are responsible for their own health, and we certainly would not deny the important role of personal responsibility. But how can we create a culture of wellness that facilitates individuals making the choices that enhance their health? And what can we do to reduce some of the barriers that inhibit individuals from making healthy choices? And how can we create opportunities? How can we bridge the ideological and political divide and come up with some fresh ideas to move us forward in terms of improving our health? There's also greater scientific knowledge on how social factors affect health. There is increasing media attention to this topic, and we thought that this is a good time. It's certainly a time of change. Today is certainly a dramatic day of change in the United States with new leadership and anticipated legislative activity on many fronts. Maybe we are in a moment where there are opportunities to move forward. So we thought, the Robert Wood Johnson Foundation thought, that a commission could raise visibility of the issue and help to expand the dialogue and to increase understanding of the issues, to think not only of the medical factors that play an important role, but how do factors outside of the healthcare system also play an important role. One of the distinguishing characteristics of this commission, I will talk to you a little bit about its makeup. It's not made up of a bunch of researchers who are looking to do more research and trying to delineate all of the aspects of the problem. The commission is very heavily focused on solutions. What are the options for moving the dialogue forward? What are the fresh ideas? What are programs that are working now on the ground in some local areas that could be scaled up to make a difference and to improve health? And how can we get fresh approaches and new ideas to improve our health? Ultimately, what the Commission is planning to do is on April 2 of this year to release a report with recommendations of how, as a nation, we can move forward. So the general goals and objective: raise awareness of the shortfalls in America's health, point to promising interventions, recommend policy options. Importantly, we are not thinking only of government action. We are thinking of both policy, both public and private actions. In fact, we've seen some examples of wonderful public-private partnerships that have been very innovative and that can make a difference. And we are thinking not just at the federal level, but at the state, local level. We are thinking of what communities can do, and we are thinking even of what all Americans can do. So we want to be broad-based in terms of the solutions that we consist of. Just to give you a concrete sense of the commission, it is housed at George Washington University, in the Department of Health Policy. That's where the central offices are housed. I work closely with Dr. Wilhelmine Miller and her staff there from my office in Boston at Harvard University. The foundation is very heavily involved. The foundation has not done many commissions before. In fact, this is the first commission. They will be doing the second ones shortly, but this is the first commission they've done. And so this is something new and novel for the foundation, and they're very heavily involved. Research is key to what we do. So we have Dr. Paula Braveman and her team from the University of California, San Francisco, providing the research support for the commission. And then we think that we want to produce a report and we want to have impact. We don't want a report that sits on the shelf. And communicating our findings and reaching out to the public and to policymakers and raising awareness of the issues and the visibility of the issues is central to what we've done. So the foundation has invested heavily in communication support. And so we have two communications firms. We work with Burness Communications and Health 360 Strategies as part of the communications effort to make sure that we give these recommendations some legs and that they have an important impact. So what exactly is the approach of the Commission? We are seeking to target decision makers in public and the private sector We are certainly trying to reach beyond healthcare to non-traditional allies and advocates. We want to make academic research on social inequalities more accessible to policymakers. We are a bipartisan commission, and we want to work in a sustainable and flexible manner that is relevant to the challenges that we face. To give you a sense of what we did before the commission was actually launched, we spent time looking at research and qualitative research in terms of how do we even talk about this challenge of health shortfalls and health inequalities in a way that will resonate to the public. We wanted to see where the public was and did public opinion polling. We did interviews with key stakeholders to assess the openness in both the executive branch as well as in both parties to the issues that we were dealing with. And we spent time looking at what might be the opportunities in terms of policy that was coming down the pike where input could be made. And we certainly gave a lot of time and attention to recruiting commissioners. How do we get the right commissioners who bring the background that is needed for a topic that is as complex as the topic as improving America's health? And we had some criteria in terms of picking our commissioners. We wanted nationally recognized persons that came from diverse backgrounds, who had networks to broad constituencies, who were both nonpartisan and bipartisan, and had demonstrated leadership and success and commitment to improving the lives of all Americans. And we ended up with an outstanding commission led by two distinguished public servants in the United States, Mark McClellan, a physician and economist, a former head of the Food and Drug Administration, former director of the Center for Medicare Services, and currently at Brookings. And then Alice Rivlin, another distinguished public servant who has served in the Congressional Budget Office, who's been a former director of the Office of Management and Budget, two persons who are very, very highly respected inside the Beltway and outside, who could bring the kind of leadership and attention to these issues that would give it credibility. And then we had an outstanding cast of characters who serve as commissioners. Dr. Kate Baker from the Harvard School of Public Health, a former member of the Council of Economic Advisors for the President. Angela Glover Blackwell, head of Policy Link, and a major community-oriented organization in San Francisco that pays a lot of attention to the social factors and community context and how that affects health. Sheila Burke, a veteran, 20 years, Bob Dole's chief of staff, former head of the Smithsonian, and now a professor at the Kennedy School at Harvard. Linda Dillman, vice president of Walmart, brings much leadership and attention and a large employer to the table. Our own Senator Bill Frist, who has demonstrated outstanding leadership in so many areas. Alan Goldston, the U.S. president of the Bill and Melinda Gates Foundation. Katie Haycock, head of the Education Trust, again, a leader nationally in terms of education policy. Hugh Panera, an important entrepreneur. He was, his name may not be a household name to you, but he's one of the founders of XM Satellite Radio. Dennis Rivera, a well-known labor leader who also works in the area of health care. Carol Simpson, a former anchor for ABC News, brings the media as one domain of society to attend to. Jim Toohey, former head of faith-based initiatives in the White House and now a president of St. Vincent College in Pennsylvania. And Gail Warden, president emeritus of a large healthcare system in Detroit. So you can see the range and diversity of backgrounds and the kind of expertise that we've pulled together to really pay attention to the issues, to help us look at the issues we are addressing and use their best judgment to come up with workable solutions.